Series available on BBC Sounds. That's called Gwreichion. It's 13 minutes past 6 o'clock. And waiting lists in Wales have grown again, with previous targets to reduce the longest waiters still not met. But in a month which saw record numbers turning up at A&E, waiting times in emergency departments improved along with ambulance response times. It is therefore a mixed picture today. Let's look closer at cancer treatment times during May. 54.1% of patients started their first definitive treatment within 62 days of cancer first being suspected. Those are the worst figures in 3 months. Simon Shearus is Cancer Research UK's Public Affairs Manager for Wales. Thanks for coming on the programme today. How does the picture, we've seen the overall statistic there, how does the picture vary across the country?
Yeah, so the picture does vary across Wales. So some health boards had only 42% of patients starting treatment within that 62 time frame. Others saw 62% within the same time frame, and that variation is unacceptable. You know, regional disparity across health boards in Wales are a concern and need to be addressed head on within the new cancer improvement plan in Wales. It's essential that we fix these variations and equalise the health landscape throughout the whole cancer pathway in Wales.
What's the link, Simon, between the delays that we see and the outcomes for patients?
So that's quite hard to answer, just because it's really hard to quantify the impact that this will have across cancer in Wales. So it's worth noting that every cancer is different and different cancers can actually progress at different rates. However, what we do know is that any delays are likely to be negative and are, again, they're pretty much a missed opportunity to save lives. So that's something that we really want to highlight in today's interview.
So there are health impacts, obviously, but I'm sure there are social impacts as well, quality of life impacts.
Well, of course, you know, those figures, beneath those figures are a lot of patients anxiously waiting across the pathway. It's not only the patients, it's their families as well. But those, in terms of other impacts for these waiting times, it's really worth noting that they kind of signify a stressed NHS service in Wales that needs fixing.
But in the middle of all that stress and the pressures on the NHS, the Welsh Government say today that more people started their first definitive cancer treatment in May than the previous month. So actual patients, not percentages here, and the number of pathways closed following the patient being informed they did not have cancer also increased. That's important to note, because what it means is there are more people coming through the system, and that's why they're taking longer to treat. Do you acknowledge that?
It is worth acknowledging. However, you know, the fact that almost half of cancer patients are not being treated quickly enough is a concern. I think that's where the focus should be on today's findings.
Where is the problem in the chain? Is it recognising problems? Is it the diagnosis itself? Is it the treatment? Where do you see the problem lying?
So a key problem boils down to the workforce issues, so capacity issues within our NHS service. So despite our NHS cancer workforce working tirelessly year in, year out, there simply is not enough workforce to meet demand in Wales. And for context, it's really important to highlight that it can take up to 15 years to train, say, an oncologist, a radiologist, or a cancer surgeon in Wales. So if we are to fix these waiting times, there needs to be long-term investment in the cancer workforce in Wales.
Has that work already begun?
So we have a cancer improvement plan in Wales. It was published in 2022. It's starting to be rolled out. However, as we saw today, it's not being rolled out fast enough. We really need to address the workforce issue head on if we are to make a real difference on those long waiting times.
Do you think that is a priority? Is it being treated as a priority?
I think that it should be a priority, because we simply cannot let this downward trend continue.
No health board has met the 75% target since July 2020. I think that's correct. Can you see us getting back to that point at all? And if so, how long will it take, do you think, Simon?
Well, how long's a piece of string? I think, there's so many issues across the cancer pathway that we need to address to bring these figures down. I think if we are to reach those targets, as I said before, we need to address the workforce capacity. We also need to optimize services in Wales by adapting the latest innovations in, say, screening and diagnosis. And finally, we need to actually look at reducing what drives cancer in Wales. So things like smoking and overweight and obesity. So all these things can make a real impact in helping Wales drive these numbers down.
Thanks very much for your time this afternoon. That's Simon Shearus, Cancer Research UK's Public Affairs Manager for Wales. 19 minutes past 6.
BBC Radio Wales Travel.